Hi, I'm Dr. Rashmi Roy, Senior Thyroid Surgeon at the Hospital for Endocrine Surgery. So today I wanted to talk to a specific group of patients who have had surgery in the past and their nerve was cut during their first operation or damaged during their first operation and now need surgery on the remaining half of their thyroid gland. So I've had a flurry of patients that have just contacted us recently who I've spoken to, so I thought it was an important topic to discuss. So these patients who only have one functioning nerve really need an expert to remove the remaining half of their thyroid because they only have one functioning nerve for breathing and talking. And so if this remaining nerve gets damaged, then the patient will need a temporary tracheostomy or even a permanent tracheostomy, which is obviously devastating. And also patients ask me, well, can you go in and fix the nerve on the other side and then operate on the remaining half? And the answer is no. So I can't fix a nerve that was already cut in a previous surgery years before. However, I can preserve the remaining nerve that you have while removing that half of your thyroid gland. So, I tell patients, look, I do this all day, every day. I have no concern that I'm not going to be able to save your nerve. I'll identify your nerve early, preserve it. It'll be in direct vision the whole entire case, and I'll stimulate it at the end of the operation with a nerve monitor to confirm its function. Now, even with the most beautiful operation, it is still possible, less than 1% of patients, even with a stimulating nerve at the end of the surgery, will have a little bit of paresis, not paralysis necessarily, but weakness of the nerve. And if you only have one functioning nerve, then even a little bit of weakness can put you in the category of needing a temporary tracheostomy. That is not my expectation. I expect you to wake up with the same voice you go to sleep with, but you do need to know that it is a possible complication, although not an expectation by any means. So if you are unfortunately in this category where you've had a nerve cut and now you need thyroid surgery on the other side, you need to find an expert thyroid surgeon. You can contact us at thyroidcancer.com. And if you want to see more interesting videos, then you can just subscribe to my channel.